graduated, I actually was more interested in geriatrics, and I was terrified of pediatrics. The little ears, the little people who couldn't really tell me how they were feeling or if I was hurting them or what I was doing to them, it really just made me nervous. But I worked at Northside Hospital for almost 10 years and then transitioned over to DeKalb Medical for the last 4 years and had the opportunity to work with pediatrics and really get comfortable with it, and it's become my favorite population. And about 2 years ago I started thinking about the possibility of doing something privately. I was getting a lot of referrals from pediatricians and psychiatrists and psychologists and speech therapists to do the auditory processing testing. It's not something that a lot of audiologists enjoy doing, so there's definitely a market for it out there. When I moved down to DeKalb from the Johns Creek area up here, a lot of my referral sources, they didn't disappear. Their patients just drove 26 miles to come see me in Decatur. So I had an opportunity open up here in Cumming, where a speech therapist who has a therapy group, pediatric therapy group, was expanding her practice, developing more space, and was interested in bringing on more professionals. And she and I just started discussions about me coming in and setting up my space here, and so that's kind of how the idea was born. I just wanted to focus on just pediatrics, an auditory processing clinic, looking at auditory development, and that all just kind of stems back from my experiences with working with the newborns from birth and doing the newborn hearing screening follow-up programs, and then just my passion of auditory processing. Every case is completely different. I think that's what I love about it the most. There's no monotony to what I do. I could see 12 5-year-olds in a row and they're all going to be different. They're going to all have different needs. Specifically to auditory processing, what I love about working with pediatrics is I know that I'm making an impact on assisting them in their future learning and in their education, and I'm helping the parents put some pieces of the puzzle together. I know I had some learning difficulties when I was younger, and I wish more of this had been done back in my generation. It might have helped me with my self-confidence in school and helped me reach a point where I felt confident about how I learn and be okay with that. So I love that I can make that impact and have that impact on children at an early age. So one of the things I love most about where I'm working currently with little listeners in this facility is I get the opportunity to work with other professionals that work closely with children with special needs. I work amongst PTs, OTs, speech therapists, and I don't contract with that company. I don't refer to them exclusively. But it's nice when they do send their patients to me that I can just walk down the hallway and have a quick meeting with that therapist about that specific child, and we can talk face to face as opposed to emailing or calling. And it's just kind of a dream I've had for years of being in a multidisciplinary environment where we can take a team approach to some of these more complex cases and really help the parents understand what they need. So that's what I like most about the environment that I've created and the space where I have set up.